Hi there. Welcome to Anima T1D. My name is Lisa, a diabetes educator, and also have type 1 diabetes.
My name is Matt. I am also a diabetes educator.
My name is Dr. Shruti Ahuja, a pediatric endocrinologist.
My name is Dr. Brian Snyder, an adult endocrinologist.
And my name is Kelsey. I am a mental health counselor. In this video, we learn what trauma is and how it may lead to post-traumatic stress. We also discuss ways to cope with post-traumatic stress and when to reach out for support from a mental health provider. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Welcome, everyone. I'm excited that Kelsey, a mental health counselor, is here today to talk to us about a really important topic, trauma.
Thanks, Matt. I'm glad to be here too. Trauma is a big topic that we all should be informed about. In our discussion today, I will provide some basic information about trauma and its impacts on health. I encourage you all to ask questions and share your perspectives throughout our time together.
That's right. Let's approach the topic from a place of curiosity and kindness. We can all learn from each other.
Sounds good. Let's go inside and talk more.
Dear viewer, sometimes hearing about trauma or talking about it can be difficult. If at any time you notice that it feels too overwhelming to be in conversation about trauma, you're welcome to take a break and take care of yourself. Remember that you can always pause the video and choose to finish watching at another time.
I've heard the word trauma a lot recently, like on social media and in the news, but I'm not exactly sure what it is. Kelsey, can you start by telling us what trauma is?
Yes, trauma has become a buzzword and sometimes may be inaccurately used in social media. In mental health contexts, like clinical services and research, trauma is broadly defined as an event or set of circumstances that threatens one's life or perceived sense of safety.
What are some examples of traumatic events?
Examples of trauma could include natural disasters, like hurricanes or earthquakes, fires, or exposure to a war zone as a civilian or through combat, like serving in the military. Whether as a single incident or ongoing experiences, physical, sexual, and emotional abuse are all types of trauma. Additionally, serious injuries, transportation accidents, and life-threatening illnesses are examples of trauma. It's important to recognize that trauma can directly happen to any of us. It is also possible to be affected by trauma after witnessing it happen to somebody else, like being a bystander to a really bad car accident, learning about it happening to a close friend or family member, or experiencing secondary trauma through your job, such as being a first responder or healthcare provider.
That's quite a list of possible traumatic events. How common is trauma?
It can be difficult to document the total prevalence of trauma due to factors like the broad definition of trauma, different cultural considerations of trauma across the globe, and the practicality and comfortability of reporting trauma. Research has estimated that about 70% of the world's population will experience at least one potentially traumatic event, with an average of about 3 events per person over the lifespan. As a reminder though, these are just estimates, and it is likely that trauma is underreported for different reasons globally.
Now that we know what it is, can you tell us a little bit about the impacts of trauma?
Yes. It is important to recognize that trauma and the effects of trauma are both highly individualized, which means that any two people can live through the same event and have different impacts from it. I want to highlight that the effects of trauma are unique to each person because we all have different circumstances, such as biological makeup, psychological health, identities, and social influences, that can all affect the impacts of trauma on somebody's life.
That makes sense. We all have unique factors that make us individuals, as well as unique life experiences that can influence access to resources during or after trauma.
Great point. After somebody survives a traumatic event, it is possible that they develop serious mental health symptoms that we call post-traumatic stress. There are 4 clusters of post-traumatic stress symptoms.
What are they?
The first cluster is called intrusions. These symptoms are recurrent, involuntary, and distressing reminders about trauma that the individual is not intentionally trying to remember.
That makes sense. Like the symptoms are intrusive to the individual's daily life, so that's why they are called intrusions.
Exactly. Intrusions can include memories, dreams, or flashbacks of the trauma, and even intense physiological reactions, like an increased heart rate, when exposed to trauma reminders. The second cluster is about avoidance.
What has to be avoided?
Symptoms of avoidance refer to an individual trying really hard to avoid distressing reminders that are associated with the trauma. These reminders can be external, like avoiding going near the location of the trauma, talking with people that may remind them of the trauma, or activities that evoke similar feelings to those that occurred during trauma. Reminders can also be internal, like trying really hard to avoid distressing memories, thoughts, or emotions that remind somebody of trauma.
What about feeling like you always have to be on guard or very watchful of your surroundings? Is that a post-traumatic stress symptom?
Yes, it is. Lisa is describing hypervigilance, which is an example of the third symptom cluster, increased arousal or reactivity. This cluster can also include having an exaggerated startle response and being really jumpy, having difficulties with sleep or concentration, being quick to feeling irritated or angry, and engaging in reckless behaviors.
What are some examples of reckless behaviors?
This is also a broad symptom, so it's always important to learn more about the behavior and ask how it's impacting an individual to determine whether something is reckless for them. But some examples might be starting to not take medications as they were prescribed or new or increased substance use. The last post-traumatic stress symptom cluster involves a negative change in mood or cognition.
What kind of mood changes?
After trauma, individuals may feel consistent negative emotions like fear, anger, guilt, or shame. They may also notice difficulty with feeling more positive emotions like happiness or love, or start to feel detached or disconnected from others.
And what kind of cognitive changes might somebody experience?
After trauma, individuals may lose interest in doing activities that are important or meaningful to them. It is possible to experience persistent patterns of negative thinking, such as believing that the world is never safe or that they are to blame for the trauma. Lastly, people may struggle to remember important parts of the trauma as if their brain blocked out the details. These are the 4 clusters of post-traumatic stress symptoms.
Thanks for helping us understand this, Kelsey. Does everyone who experiences trauma develop post-traumatic stress?
No. Just as I noted that it is difficult to document the total prevalence of trauma in the world, it is also difficult to document total prevalence rates of post-traumatic stress. Instead, using rates of post-traumatic stress disorder, or PTSD, can be helpful because it's a diagnosed mental health condition. When symptoms of post-traumatic stress contribute to consistent difficulties with daily functioning or cause a lot of distress, somebody may be diagnosed with PTSD. It has been estimated that about 4 to 6% of people who experience trauma are diagnosed with PTSD at some point over their lifespan.
Why is trauma important to be aware of in the context of diabetes care?
Research has found a connection between post-traumatic stress symptoms and worse general physical health. The overactivation of stress response systems in the body, such as what happens in post-traumatic stress, can decrease insulin sensitivity and glucose metabolism. Links have also been found between more post-traumatic stress symptoms and higher acute and long-term blood sugar and maintenance of health behaviors like glucose monitoring or medication adherence. There is also an increasing awareness of medical trauma, and calls for trauma screening and trauma-informed healthcare have been made to promote holistic diabetes care.
You've shared a lot about the adverse mental and physical health impacts that can occur after trauma. It's hard not to feel completely hopeless or powerless about trauma.
I have shared a lot about the very real adverse impacts of trauma, but I don't want us to be left feeling hopeless or powerless. There is something called post-traumatic growth, which is the potential for somebody to experience positive psychological transformation after trauma. Post-traumatic growth is also an individualized process that is unique to each person, but some examples of post-traumatic growth may include finding a sense of personal strength, deepened appreciation for life, improved relationships or connection with community, renewed values or perceptions of living in a meaningful way, or spiritual growth.
Wow, those are all really impactful outcomes.
I agree, Lisa. I wanted to add that post-traumatic growth does not deny or diminish the severity of trauma and adverse outcomes that somebody experiences. It is possible to experience post-traumatic stress and post-traumatic growth. Everyone is on their own journey through life, and the ways that we are exposed to trauma and impacted by it will not be the same.
This is a good reminder that, although trauma is a serious, adverse experience, survivors of trauma are incredibly strong and resilient. The potential for living a meaningful life still exists even in super difficult times. Speaking of hope, How can we help our patients or somebody we know who has experienced trauma?
Dr. Snyder, great question. Having an awareness that trauma exists and some sensitivity to the potential impacts that trauma can have on people is a helpful first step. Sometimes this is called being trauma-informed. In the context of healthcare, you are never expected to provide mental health support to your patients, since that is beyond your scope of practice. However, you may still learn about the impacts of trauma on your patients' lives, especially if the trauma is related to diabetes like their diagnosis or an extreme episode of hypo or hyperglycemia. It's important to understand how underlying mental health symptoms, like hypervigilance or avoidance, may be barriers to healthy diabetes management behaviors.
I've learned so much today. Sometimes it can be easy to get frustrated when patients don't take their insulin or carb count properly. But I'm learning that there may be underlying reasons why they are doing certain things.
Right, it could be trauma-related or it could not be. If you do learn about mental health challenges, especially when they are adversely affecting your patient's diabetes management, having a list of resources and referrals for mental health support could be useful for your patient if they are interested. Sometimes people just don't know where or how to start looking for help. Providing some ideas for a starting place can be helpful.
I have found that patients will be more open, trusting, and empowered when they are treated with compassion. Sometimes it's really hard, especially after a long day or when somebody is upset with us, but when we intentionally interact with people from a place of non-judgment, acceptance, and kindness, it increases the sense of safety in the space.
Nobody deserves to experience trauma, and it's never their fault. While disclosing trauma should always be done as a choice by the survivor, talking about it can still be difficult. When somebody discloses trauma to you, please meet them in a caring way. Thank them for sharing with you, then validate any emotions that may be expressed, and don't pry for details. Ask what kind of support they have or what they may need. Do your best to connect them with care options if they are interested. Trauma is broadly defined as an event or a set of circumstances that threatens a person's life, bodily integrity, or perceived sense of safety. Anyone can experience trauma, and global rates estimate that most people will. Trauma can lead to adverse mental health symptoms, called posttraumatic stress, and may include intrusions or avoidance of trauma reminders, negative change in mood or cognition, and increased arousal or reactivity. Trauma can also lead to post-traumatic growth, a positive change such as a greater appreciation for life or renewed values. Notably, everyone's experience of trauma and healing trajectories are different. Trauma is an important factor to consider in diabetes care, to identify if mental health symptoms are preventing the consistent use of health behaviors and leading to acute or long-term diabetes complications. There could be additional complexity if the trauma is related to diabetes. If you or somebody you know is struggling with trauma, reach out for support. Several options exist for care, such as individual psychotherapy, mind-body interventions, peer support groups, or medications.
Thanks for talking with us about trauma, Kelsey.
Yes, thanks. I learned that trauma is pervasive across the world, and we are likely interacting with people who have experienced trauma and may be navigating the diverse impacts that trauma can have on life.
Agreed. Through being mindful of my interactions with others, I'll strive to be supportive, understanding, caring, empathetic to reduce mental health stigma.
Absolutely. And remember how there are connections between mental and physical health, so trauma should be acknowledged and addressed in diabetes care.
These are all great takeaways. Let's carry them with us in all our interactions. We never fully know what somebody is going through. Through this playlist, we will learn what mental health is, common mental health challenges that people with diabetes experience, and strategies to support mental well-being. To learn more, check out the resources in the video notes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.